Hope your work week is off to a good start. You're watching Arirang TV's special coverage of COVID-19. I'm Min Son-hee. The 21st National Assembly has begun its term with priority expected to be placed on efforts to tackle COVID-19 and to shore up the economy. We now begin the program with Monday's headlines with our Kwon Soa and Noaram. Welcome.
Hi.
Hi.
Soa, how are we starting the new month and the work week?
Well, usually on Mondays we have less new cases, but because we have less tests conducted on the weekend, but that doesn't seem to be the case this time around because especially with the sporadic cluster infections that we are seeing and which are remaining a big concern. As of 12 a.m. this Monday, we have 35 new cases reported, bringing the total to 11,503 and one more death, raising the death toll to 271. And we have 17 additional people in quarantine and also 17 who have fully recovered. Now, by region, we have one new case in the capital Seoul, but nearby Gyeonggi-do province and Incheon are more affected with 12 and 18 cases respectively. And there's also one case each down south in Daegu and Jeollanam-do province. We also have 2 cases that were detected at the airport, and out of the 35, 5 were imported cases. Now, the numbers have been fluctuating in recent weeks due to recent cluster infections. We see on May 26th, we were still in the teens, but then we see our daily cases surging to 40 to 79 even, and then we do see a decline to the 50s and 30s and even 20s over the weekend, and now we are back to the 30s. So it is really difficult to predict how these numbers will develop from here on. The government is warning of new sporadic cluster infections, not only the bigger ones we know of linked to a clubber in Seoul's Itaewon district and the recent surge in cases related to a logistics center in Bucheon, which is now seeing a decline. Authorities noted that sporadic transmissions of COVID-19 have been detected at churches as well, noting that those include small religious group gatherings that did not abide by social distancing measures. Health officials asked those in the metropolitan area to refrain from unnecessary gatherings, stressing that more than 7% of recent cases are unidentified so-called silent cases.
Right, so I hear that we also have guidelines for those choosing to go to the beach this summer.
Yes, as the weather is getting warmer and warmer and the month of June has just kicked off, there are beaches starting to open, such as the popular Haeundae Beach in Busan, which we're seeing here right now. But it won't be the same as going to the beach a year ago. Almost 270 beaches will gradually open to swimmers until July across the nation, which is why the government asked for proper disinfection and quarantine measures to be followed by operators as well as visitors to do their part in trying to avoid COVID-19 infections. And that includes visiting in small family groups, distancing of at least 2 meters. And that's also why parasols are to be installed in that way as well, and extra precaution at shower rooms.
Now here overseas, U.S. demonstrations over the death of George Floyd are also raising concerns of the possibility of new COVID-19 cases.
Right, this as these recent protests coincide with the relaxing of social distancing measures, and health authorities are warning of new outbreaks as it is difficult to observe social distancing during demonstrations. While some are masked, others are not. Minnesota's governor stressed the country is still in the middle of a pandemic. And similar warnings were also echoed by Atlanta's mayor, who called on protesters to get a COVID-19 test if they were out demonstrating, stressing, quote, "There is still a pandemic in America that's killing Black and brown people at higher numbers." And numbers suggest racial minorities in the U.S. are hit at a higher rate, as African Americans account for 13% of the U.S. population, but they reportedly take up a quarter of COVID-19 fatalities in the country.
Meanwhile, Brazil and Egypt are here, so record-breaking figures this past weekend.
Yes, let's start with Brazil. Brazil's coronavirus deaths has jumped by almost 1,000 a day, now being the country with the 4th highest number of fatalities around the world. Its total number of infections has surpassed 500,000. According to Brazil's health ministry on Sunday, 956 people died in the span of 24 hours, along with 33,000 new patients. Brazilian President Jair Bolsonaro gathered with crowds of supporters unmasked despite continuous criticism over his downplaying of the pandemic. And meanwhile, over in Egypt, new cases surpassed 1,000 for the fourth straight day, with a new record of more than 1,530 infections on Sunday. The country also reported its highest single death toll of 46 people. Egypt has been under a nighttime curfew since March 25th to curb the spread, with the latest renewal of hours reduced from 10 to 9. And let's take a look at our global figures. The U.S. has more than 1.8 million cases now, and we talked about Brazil. Let's take a look at Russia with more than 405,000 total cases. And moving over to countries with more than 150,000 cases, there's been a surge in cases in India, surpassing a couple of countries over the weekend. And also Peru is another country with faster rises than other countries with more than 164,000 cases. And those are the global updates.
All right, so thank you for that. I'll come back to you for more on the domestic updates after the regular briefing. Meanwhile, Arirang, President Moon Jae-in is set to preside over an emergency economic meeting soon. Tell us more.
Yes, that's right. The main agenda for the sixth session of the Emergency Economic Council, which will be held at the Blue House, will be the government's third extra budget plan. Now, it's expected to be the biggest single supplementary budget in the country's history and could amount to as much as 50 trillion won, which is just over 40 billion US dollars. Now, it's aimed at stemming the economic fallout from COVID-19, of course. Now, in a separate meeting earlier today, the government and ruling Democratic Party agreed in advance to earmark the budget with an aim to get it passed in Parliament next month. Finance Minister Hong Nam-ki, who was in that earlier meeting, said the government is planning to spend 75% of the new budget in the 3 months following parliamentary approval. Moon is also expected to draw a more specific roadmap for the reshoring of Korean manufacturers abroad, as well as the economic policy direction for the second half of this year.
Meanwhile, restrictions on the purchase of face masks, I hear, have been eased as of today.
That's right. Government rationed masks are now available for purchase at pharmacies on any day of the week. The eased measure took effect today. People under the age of 18 will be allowed up to 5 masks per week. That is 2 more than adults, given the resumption of in-person classes at schools. Now, identification checks, however, will continue to prevent mask hoarding, and the price is unchanged at 1,500 won, or $1.20 per unit. The number of masks purchasable was initially set at 2 per week, and that amount was increased to 3 last month, and that 3 is still the case now. As the weather is warming up as well, the government is urging manufacturers to produce more breathable masks, ones that are used by surgeons mostly.
Well, that is good to hear. Now, QR codes, we talked about this before, to track visitors to high-risk businesses. I understand there is a test run that begins today.
That's right. So entertainment venues will be required to register their customers with QR codes so they can be easily located if need be. Now, a test run at 19 facilities in Seoul, Incheon and Daejeon begins today until Sunday, after which the system will officially launch nationwide. Restaurants, cinemas and even churches will also be subject to the measure. Visitors to these facilities have to get a one-time QR code via smartphone apps and submit it to the venue. The menu staff, meanwhile, will then scan the code and include it in a digital customer register. Now, all information will be stored for up to 4 weeks before being deleted automatically. Officials have so far had to rely on CCTV footage and mobile access records, as well as credit card transactions, to track down infected cases. And people were also giving false information, which also caused a headache for officials, making it harder for them to determine these infection routes.
Right, Aram, thank you for that. We'll see you again on Tuesday. It's time now to turn to the regular government briefing on COVID-19 here in this part of the world. The most recent venue of cluster infections here in Korea appears to be a church in Incheon, where at least 18 people were found to have tested positive for the virus as of early Monday morning. Now, this venue follows the logistics center in Pucheon and the clubs and bars in Seoul's Itaewon district. We have the briefing up next, I think, so we'll come back to you afterwards.
First, here is Director Chung Eun-kyung with the briefing. Let us now begin our regular briefing for the COVID-19 response. As of June 1st, midnight, we have 35 new cases. And the total number of confirmed cases now stands at 11,503. And 17 more people have been discharged, and a total of 90.6% have been fully recovered, and total of 810 people are still in quarantine undergoing treatment. Out of the 35 cases so far, we have 5 imported cases, while the rest of the 30 were local transmissions. Out of the 5 imported cases from America, there were 3. 2 were from the Europe. And as for the local transmissions, here are some details. In the Gyeonggi-do Bucheon at the Kupang Logistics Center, we have, compared to the day earlier, we have 3 more cases, and the total number of confirmed cases stands at 112. And 74 of them are workers, and the 41 are contacts, and 50 in Gyeonggi-do Province, and 44 in Incheon, while 19 in Seoul. And as for the Gunpo pastor, there are 9 people confirmed so far, and so far at 12 churches. From the 27th of May, we had the Jeju trip by these pastors, and I believe that this was the major source of infection, and we are currently doing the epidemiological investigation. At Anyang Church, we have 5, and Gunpo have 2, and also another church at 1 person has been confirmed. And with the new cluster infection, there is a cluster infection at the church in Incheon, and a total of 23 have been confirmed so far. About 13 churches were involved, and they had prayer meetings, and they also shared vehicles, and I believe these were the major sources of infection, and we are currently conducting testings as well as contact management. And in Incheon, regarding 11 churches, we have 23 confirmed cases, while 2 people also from other city has been confirmed positive. And the KCDC is currently witnessing a surge in the outbreak centering around religious facilities and places of worship, and therefore we urge you to meet through non-physical means. And we have confirmed that there were 6 major cluster infections so far, and the details are included in the press kit. And in the metropolitan area, we ask you to refrain from having small group meetings at churches and other religious facilities. And as for the people of aged over 65 or pregnant women and people with chronic illnesses, they need to be on special alert. And within a small group, we have found that there has been 1 death and 1 is at critical stage. So for the high seniors and also the high-risk groups, we ask you to refrain from going to these small group meetings. And if you have to have small group physical meeting, please have distancing with each other, and please meet with minimum members, and please confirm your health conditions before you meet, and please wash your hands often and also wear your face mask, and refrain from engaging in activities like shouting or chanting that increases the risks of droplet infections, and please avoid dining together. And the KCDC, as we are seeing the resumption of the schools, we ask the schools to abide by the quarantine measures, and if you feel sick, please visit the screening clinic and get tested as soon as possible. And even before you visit the screening clinic, please refrain from going to other multi-use facilities like PC rooms and singing rooms. And even at homes, please use your own utensils and refrain from and minimize contact with your family members. And please keep personal hygiene measures, including washing of your hands. And we are seeing continued cluster infections here at the metropolitan area. And one of the most important sources of infection were three types. First were the transmission of religious activities. There were a big surge. And as we said, there was the pastors' meeting and choir, as well as the Universal College Christianity member groups. And we saw a large surge in the number of confirmed cases. And this also puts at risk their family members and their other service members, and also putting at risk to their colleagues as well. As we mentioned, one person has lost her life, and also we have one person in critical condition. So until the COVID-19 is stabilized, please refrain from meeting physically and have online meetings. And also keep regular quarantine measures at these churches. And also, second, there were high infection among the logistics center and call centers and other facilities, business establishments that have high risk of infection. And even one person could lead to a large cluster infection at these establishments. And we ask the businesses to analyze their own infectious disease risks and also train their employees and also provide support for the people with symptoms. And on the government level, we will also provide the necessary support. And third, there were infections among the after-school private academies. As for private academies, it is recommended to have online classes. And please have 2 meters of distance and ventilation. And please enable everyone to wear face masks. And please abide by quarantine measures strictly. And as we witness a prolonged COVID-19, many people are feeling fatigued over the necessary balance between quarantine measures and daily routines. And we are also seeing that we need to also continue to make efforts to build a safe environment at many groups. Thank you very much.
Right, so that was our Chung Eun-kyung, the head of KCDC, with Monday's afternoon briefing. Do give us a summary of the key announcements.
All right. Well, Chung Eun-kyung mentioned that there have been a lot of cluster infections in the metropolitan area, and this is why she broke these major sources of infection down into 3 types, 3 groups, maybe I should say. The one is related to religious gatherings, because we saw that new cluster infections have been occurring at a number of churches and other smaller religious groups. And she also mentioned that a person recently died related to religious infection, and another person is currently in critical situation. So that was the first one. And the second one is at places like distribution centers and call centers, which are, as we know, high-risk facilities. And the third she mentioned was after-school academies, or cram schools, as we know here in Korea. And she asked for those cram schools to expand online classes as an alternative. And meanwhile, related to the Kupang Distribution Center in Bucheon, 3 more cases have been added today, bringing the total to 112, which actually means that the number of new cases has been on the decline recently.
All right, so thank you for that. We'll see you again on Tuesday.
Thank you.
Now, just as we saw in the government briefing earlier, sign language interpreters are doing their part to promote better awareness of COVID-19 among those with hearing disabilities. Korea is home to more than 360,000 citizens with hearing impairments. And in this next report, we take a look at the work done by sign language interpreters to bridge the communication gap.
The South Korean government holds 2 press briefings every day to provide COVID-19 related updates for the country's citizens. The expression worn by KCDC chief Chung Eun-kyung is usually very somber, but her sign language interpreter is far more animated, using a variety of body movements and facial expressions to convey information to those with hearing disabilities. The open and transparent disclosure of information, as well as a 2-way communication channel between the government and its people, are the key components of Korea's effective disease prevention and control framework. It also recognizes the value of diversity and inclusion, and therefore, information is not only provided orally and verbally, but in sign language as well. This is a sign language interpretation center in Seoul, set up to aid citizens with hearing disabilities. Recently, the center has received a flood of COVID-19 related inquiries and requests.
카드가 고장났든지 아니면 카드를 잃어버렸을 때 다시 만들어야 될 때 수수료가 2,000원이 필요하다는 말이에요.
Sign language interpreters are hard at work, trying to absorb the many new words and expressions that are now seeing popular use due to COVID-19. Sign language interpreters have uploaded videos on the internet showing a step-by-step guide on how to follow safety measures, apply for emergency relief funds, and providing other useful information. They also played an instrumental role in allowing Korean nationals abroad with hearing disabilities to return home safely amid the COVID-19 pandemic.
정보 한계가 있었기 때문에 한국으로 다시 들어오는 비행기 티켓 구매와 비자 문제, 그리고 지금 모든 지역이 이동이 금지되었기 때문에 필리핀 공항으로 오는 이동 차량에 대한 문제가 있었습니다.
It's a meaningful occupation, but face masks have been giving them trouble.
통역할 때는 표정이 중요하기 때문에 대부분 통역할 때 마스크를 벗고 통역을 합니다. 그러나 이제 사람들이 많고 이제 밀집된 지역 안에서는 저희 통역사도 좀 안전을 위해서 이제 농아인분께 이제 양해를 구하고 이제 마스크를 쓰고 통역을 합니다. 근데 그때 저희 이제 걱정은 이제 통역이 잘 전달이 안 될까봐 그런 거에 대한 상황이 조금 통역사 입장으로는 좀 힘든 것 같습니다.
Sign language interpreters are hard at work to ensure that those with hearing disabilities stay accurately informed and are not left behind amid the COVID-19 pandemic, underscoring the inclusive and accessible characteristics of K-quarantine.
당신 덕분입니다. 존경합니다.
The COVID-19 outbreak in Korea is on the resurgence, stemming from the latest cluster infection at an e-commerce logistics center. Similar outbreaks have also been reported by global delivery service firms in other countries across the world. In the United States, at least 5 FedEx employees died recently at the company's hub facility in New Jersey. The latest cluster outbreak in Korea has triggered alarm bells over possible chain transmissions in the local community, with the number of ill workers being outpaced by that of their family members and friends who also contracted the virus. This could lead to a new surge in cases, especially when considering the population density and movement patterns exhibited by those living in the capital region. Amid the ever-present danger of a resurgent outbreak stemming from unexpected and sporadic cases, the race to find a cure or vaccine to COVID-19 has become more urgent than ever before.
COVID-19 infections are on the rise in Korea, with the more recent outbreak at an e-commerce logistics center in the city of Pucheon, west of Seoul. For more on the latest efforts to find a prevention or treatment for COVID-19, I have Dr. David Kwak from Suncheon University. Welcome back, Dr. Kwak.
Good afternoon.
And I also have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome, Dr. Kim.
Good afternoon. Thank you.
Dr. Kwak, let's start with you. Let's begin with the speculation over the cause of the latest outbreak at the logistics center in Pucheon and perhaps how much of a risk it poses for efforts here to contain the virus.
Well, I want to begin by looking back about a month of time. When we decided to take down a notch of the levels of the sanitary measures from social distancing measures to a daily life measure. These sort of things were, I can't say really highly expected, but these were to be expected. So these sporadic infections and it eventually causing cluster infections here and there, it's not something that we should be completely scared of. It's something we could be prepared for, and in insertion of methods like individual sanitizing methods and etc. So I would say that the on and off of cluster infections is something to be speculated in even in the future, but hopefully we'll be better prepared for the next time that we'll be able to mitigate when it occurs.
Right. Then as Dr. Kwak mentioned, Dr. Kim, I suppose we'll continue to see numbers of daily infections fluctuate between the highs and lows in the absence of a proper medical treatment for COVID-19 then.
Well, I think the current situation will continue without the proper herd immunity, and then thus such a herd immunity is acquired either naturally, well, this is a digester, or like a vaccination. And then we can do some clear all the coronavirus infection in Korea, but without some strict border controls. Just the current situation will continue.
I see. That's quite sad to hear, though.
It is sad.
Well, let's take a moment now to turn our attention to Germany, where health officials are working to contain a similar outbreak. More than 70 workers at a depot operated by UPS have tested positive for COVID-19. For more on the situation there, I have Wolfgang Bauer, a journalist for Die Zeit in Germany. Hello, Mr. Bauer.
Good afternoon. Good morning.
Right, it's the afternoon here. Do we know the cause of the latest cluster infection at the UPS distribution center?
Yeah, it's still difficult to say because our tracing system is by far less advanced than the South Korean one, I need to say. As you said, 72 employers of this UPS base nearby Hanover were tested positively. Still, they haven't tested all of the 900 employees of this center. And they haven't supplied tests for the kindergartens and schools what were affected by this recent outbreak either. So that's not the first cluster outbreak we had in distribution centers. We had just a few days ago an outbreak, a smaller one, 53 infected persons in a branch of Amazon. Before we had an outbreak, a very small one in the branch of DHL. And the problem is, I think the problem they all have in common, underpaid jobs, bad working conditions, because we, the customers, want to have it cheap. So they employ day laborers who often also sleep in company dorms, densely populated with problematic hygiene conditions. And we know this from other countries as Singapore. That is the ideal breeding ground for the virus.
Yes, unfortunately it is. Mr. Bauer, there was another cluster case involving, I think, some 100 people at a church in Frankfurt. How are authorities there responding to these latest series of infections?
They do testing, they do quarantine, but obviously the threat that the virus can infect people through air, it's a much higher one than so far known. There are some studies published recently by the magazine Science, saying that without the mask, you can infect it in rooms indoor, not only within a distance of 2 meters, but even 6 meters. So this church, to my knowledge, didn't conduct any major mistakes or flaws. But still we need to learn on a daily basis.
Of course. Mr. Bauer, there has been an ease in quarantine measures in Germany in recent times. Are you expecting a shift in the easing of these measures in light of the latest outbreaks?
Yeah, we have an ease of the lockdown we had. Actually, I don't suppose any changes in the reopening of the restaurants. All in all, the numbers are dropping since several weeks. Since spring started, we started with 6,000 new cases per day in April, and are now in between 200 and 700 per day. So I'm optimistic that these incidents remain quite isolated incidents. Four restaurants have opened again, bars have opened again, streets are full again, and the markets are crowded. The number of new infections keep dropping. If it's related to the higher temperatures, to the obligation to wear masks, something new for us Europeans, or to the fact that people spend more time now in open spaces where the virus can't be caught easily, that's what our experts are still not sure about yet.
Right. All right.
And but are all now fear, of course, the autumn. But again, it's highly doubtable that the government will be able to use the lockdown tool again, because many economists are concerned that the German economy would suffer substantial and serious damages from a second lockdown. Many companies what survived the first lockdown will fall in a second one, and the violence in the families are rising. We have delayed, to my knowledge, 53,000 cancer surgeries because of Corona. So I think neither economically nor psychological we can stand a second lockdown. We need to find other ways to combat the virus, smarter ways, perhaps more Korean ways.
Right. That actually is a reality for many companies and for people around the world as well. All right, Mr. Bauer, thank you very much for your time and for joining us live at this hour.
Thank you so much.
Dr. Kwak, I ask you the question that I asked Mr. Bauer as well. Do you believe that we should reimpose stringent measures in light of the latest series of infections here in Korea?
And I would give you a firm answer, no, for now. As we've seen with the newest confirmation numbers, it has also decreased once again, from the past week. And we are going to see a lot of ups and downs in the future, and hopefully the amount of the increase will decrease eventually. But also to lockdown, I wouldn't say lockdown, but to notch up again from the daily life confinement to the social distancing measures, it'll take away a lot of the socially circulating economy, and also as the Germany went through, a lot of the postponements in the regular scheduled surgeries and whatnot that in the medical sector we also have to face too. So taking up a notch again will not be a method that we should take, but instead I think reassertions to people that we need to take this seriously, even if we are seeing numbers decrease, is another step that we as a nation could take. It's more of an individual responsibility now, rather than just putting it out to the government to take care of all of this. We should all individually take care of ourselves, keep the sanitizing measures, wear the masks at all times, and those are the steps that we could probably take for now.
Right. Dr. Kim, traces of COVID-19 were found on many office equipment at the logistics center in Bucheon. My question is, can the virus be transmitted via delivery boxes if they've been handled by an infected person?
Well, actually, a couple of months ago, there was a report on the relative stability of the viruses on the different surfaces. But in my opinion is, I think the chance of virus transmission is by boxes and then the packages are just pretty low. So I think as a precaution, I would suggest maybe just the washing hands after receiving and unpacking. That's my suggestions.
I see. Dr. Kwak, you talked about taking proactive measures as individuals of this country to try to contain the virus. Keeping that in mind, what kind of proactive measures are we looking at? Are we looking at public campaigns or raising better awareness among children at nursery schools?
Right. So when the pandemic hit the European countries and in America, we saw a lot of public figures come out to tell the nation, basically, tell the people that how self-isolating themselves and going into self-quarantine could help out the nation in the end. I think that's something we could do here as well. We've seen a couple of entertainers come out on their social medias and emphasizing how important this is to keep sanitizing ourselves, wash our hands, and wear the mask. But I think there could be more people. I hope what government cannot actually mandate it, that all these figures come out and do it. But it seems like what we need now is more of a coming together as an individuals to encourage each other, reassert each other that the individual sanitizing measures is the most important part here.
Right, so the public can do more.
Exactly.
Right. Dr. Kim, what can you tell us about the anti-Ebola drug, the remdesivir, which has been approved by the government here to treat COVID-19 patients?
Well, as you said, the remdesivir was actually recently approved for the emergency use. And then according to the recent report, the efficacy is pretty much modest at this moment. But then in fact, it has reduces the recovery time of the patients from 15 to 11 days. But the effect is not really, dramatic. Compared to the Tamiflu when you use for the flu infection. So still we need some better treatment options.
I see. And speaking of that, Dr. Kwak, how far has the world come in terms of finding a vaccine or a cure for COVID-19?
There are many different clinical trials being underway for different types of vaccinations and also possibly treatments. As we know, there was another company that just came out with their own report saying they had a significant improvement in the people that vaccinated. I'm not really going to tell out the name here, but there is also a case of remdesivir. Even though Dr. Kim said there wasn't really much of a significant improvement, I still take that as a significant improvement because it still changed some numbers, and it's being in a hopeful way that I approach this. So some of the medications, some of the vaccinations are now going to go into phase 3 of the clinical trials, and that means that it's going to be implemented in a whole lot more people than before. If we compare the numbers, if they gave it to, let's say, 45 people before, they're now planning to give out to, let's say, thousands and 10,000s of people now. So we would definitely see the results of those come out hopefully soon. But one thing we have to keep in mind out of this is that usually for these vaccinations and medications to go through a certain process of testing, it takes at least a few months to even a decade for usual cases. But this being the very dire situation that we're faced in, I think hopefully we're going to get some results hopefully within a few months of time.
Right, because we are racing against time then.
That's true.
Dr. Kim, speaking about clinical trials, a Korean drug is involved in clinical trials in Russia, I understand. When compared to its global counterparts, would you say Korea is ahead or behind its partners abroad?
Well, I think in the global scale, global standard, we are doing pretty good job. This is just an emerging, infectious disease. So no one is actually ahead of us at this moment. So we are doing pretty good job. And in terms of drug development, I think 3 different ways are actually just the 3 different approaches. The first one is drug repositioning, which is actually exemplified by the remdesivir and the chloroquine and the collateral. And then the second one is a plasma therapy. And the third one is a therapeutic antibody. And then I know some companies are really good job. They are showing very good progress developing such kind of therapeutic options.
I see. Dr. Kwak, health authorities claim that the next 2 weeks are going to be crucial in determining the course of these recent outbreaks. What can we do as members of the public and pundits as well to ensure that we will be on a better path in the near future?
And I have to reemphasize again, it's about individual sanitizing measures, really. If I go back again to the month ago, we sort of talked about the same issue that we faced about a month ago. Back then, it was also another 2 weeks of critical time that we were facing. And back then, it was also the people who went out and got themselves into trouble by not wearing masks and gathering in mass numbers and whatnot. It is exactly the same issue that we're facing today. If we refrain from going to, let's say, gatherings of 3 or more people, also, if we keep our masks on when we also go out to meet others, if we start to wash hands at least 30 seconds each time we go to bathroom to wash our hands, it's going to definitely take us to the right path and get us definitely better answers. If we look at the infectious diseases, not even just coronavirus, but all the infectious diseases altogether, keeping sanitizing measure is the first step we need to take in regards to prevention. We probably, on the news, I remember seeing a segment that we're also seeing a drastic decrease in the numbers of general sickness as well.
I was just going to ask you about that.
Exactly. So we're seeing a big decrease in numbers of people having common cold, other infectious diseases that we used to see. So if we keep these measures up and going, I am very hopeful that it's going to take us to a whole new society where we are much less worried about not just the COVID-19, but all the other infectious diseases as well.
Is it true that we're also seeing a dip in numbers of people suffering from food poisoning?
Yes, food poisoning, common cold, and a whole lot of different infected diseases at this point.
I see.
Yeah.
Dr. Kim, what are your thoughts on efforts to contain the virus at this point?
Well, I think I would say just it ain't over till it's over. Although this expression was originally used in the different context, but I think that this is very important. And then the second thing, as you said, try to keep the social distance. And we have to get used to this kind of just behavior. And then the third one is, I think, and also very important thing is wear mask and wash your hands. And that also have some additional effect, as Dr. Kwak said. So it's very important, yeah.
Right, for wearing masks and washing your hands. As
Right.
a health expert, apart from that, is there anything else you'd like to add, Dr. Kwak?
Some of the doctors came out and said actually brushing your teeth also helps. So I guess any type of sanitizing measures, bringing the alcoholic hand sanitizer with you wherever you go. But obviously also being careful where you go is also a very important part of this. So if I wouldn't say that we should all just confine ourselves to our homes and not go out at all. But if we could find the most careful way of taking parts in daily activities and also keeping all the sanitary measures, I think it'll be very a good prospect for us. But that also includes, obviously, wearing masks, hand washing, also keeping distance when we talk. 6 meters, I would say 6 meters or more, 2 meters or more would be definitely helpful, but also encouraging each other, because that's something what we need right now. Because we're so eager to get back into the society, we're not actually helping each other to join back again to fight against the COVID-19, I think. So I think it'll be time for us to actually tell the family members that, okay, well, I'm going to postpone our meeting until when this gets better, but also, why don't you also tell your friends to join us to fight against the COVID-19?
Right, boost morale among the public then.
Exactly.
And focus on your personal hygiene measures.
Mm-hmm.
All right, Dr. Kwak and Dr. Kim, thank you very much for your thoughts today.
Thank you.
Thank you.
Right, that brings us to the end of Monday's edition. Do join us again tomorrow as we continue to seek efforts to contain COVID-19. In the meantime, do share with us your thoughts and inquiries through our social media accounts or homepage arirang.com. Thank you for watching.